Welcome to Wimmer's Wilderness. I'm your host, George Wimmer. I have 30 years of volunteer work, community organizing, and 16 years in local government, 12 of those years as mayor. Wimmer's Wilderness is an informed look at politics, community, government, environment, and education from a local perspective. In episode 3 of 5 Minutes or Less, I thought it would be good to take a look at public health departments. We've had a lot of discussion the last couple weeks about public health. A lot of that centers on federal and state actions that are taken or not taken, and how prepared or unprepared they are. But the front line is going to be the thousands of health departments, whether they're a city public health department or a county health department. So I really thought it would be important to touch upon those and give a little bit of information as well. So public health's mission is to protect health, prevent disease, and promote health and well-being for everyone, and to advance health equality. Public health promotes healthy behaviors such as engaging in regular physical activity, eating healthy foods, and refraining from tobacco use to reduce the likelihood of developing a chronic disease. It also advocates for access to health care coverage and a regular source of care, which are important for early detection and management of any kind of chronic diseases. Public health also ensures safe drinking water, promotes childhood vaccinations, and provides sexual health education to ensure the health of all residents. They also work to ensure those basics of having safe food, safe water, and safe housing. The county health departments improve health status by preventing epidemics, protecting against environmental hazards, and encouraging healthy behaviors, preparing for and responding to disasters, and assuring the quality and accessibility of health services. Public health departments work on such issues as obesity, the opioid epidemic, women and children issues, for low-income women and children who need to make sure that they have proper medical and food and safe housing. And then alcohol abuse and things like nitrate contamination, to name a few. Each county or city health department is different and has a different role to play depending on which state they are in. But the big umbrella ideas are planning, prevention, and preparedness. Planning to me encompasses the collection of data and public health issues, and then developing long-term plans to make improvements. Having long-term solutions that can shift issues like health inequities or systemic pollution from community sources, that's going to improve public health for generations to come. Prevention can cover such things as reducing smoking, getting people to exercise more, that's safe food, water, and housing, along with promoting healthy diets and access to health care. Preparedness, that's all about making sure that resiliency is built into the public health system. To me, this means that when the next big health scare or natural disaster occurs, you have built up community trust and communication channels to ensure the public knows what to do and that they're going to listen to you as well. Thank you for joining us today for episode number 3 of 5 Minutes or Less. We go much more in depth on this topic of public health with a 50-minute conversation with a county public health director in Wimmer's Wilderness podcast number 35. That episode is going to drop on March 11th. Help us spread the word by telling your friends, family, and heck, even your frenemies that you can find us on YouTube, iTunes, Spotify, Luminary, iHeartRadio, Stitcher, Google Music, and on our website, wimmerswilderness.org. Thanks for listening.